Hello, Pain Free for Life members, and welcome back to another Monday 10-minute training. I'm Dr. Rob Van Bergen, and today, as requested by members, we did a little poll a couple of weeks ago. We're going to be covering Candida. So, we're going to be talking about both systemic and oral Candida, as well as vaginal Candida, and how we can support treatment with microcurrent therapy. So, candidiasis is a fungal infection that is caused by a yeast, which is a type of fungus, called Candida. Some species of Candida can cause infection in people, and this is when we start to come into play here with how people get these infections. The most common of these is Candida albicans. It's probably something many people have heard of before. Candida normally lives on the skin and inside the body, like our mouths, our throats, our guts, the vagina, and it doesn't cause problems. But certain lifestyle factors, immune system failures or weakness, or just really plain bad luck can result in Candida overgrowth. So the overgrowth can then lead to issues such as oral thrush, tiredness and fatigue, joint pain, kind of recurring genital or UTIs, urinary tract infections, digestive issues, skin sinus infections, and then skin and nail fungal infections. Nail fungal infections are very common as well. People will often ask me about this. So it's really letting the candida get to that point is really something obviously that we want to avoid if we can. Barring the usual candida prevention, I'm not going to get too into that today, but tips and prevention things can be like general exercise, managing stress, because all these things impact our immune system and our body's strength, as well as the time tested cutting out essentially all refined sugars to starve the candida to death. Many people, even in doing those things, find themselves kind of at the mercy of their candida infections. So it is fairly common when people come to us that they don't need to know that information. They are saying, look, I have had this problem for a little while now. It's not going away. Is there something microcurrent can do for candida? And the answer is complicated. And if I were to be asked if there was some one sentence answer, it had to be short and sweet, I would have to reply with a simple yet very uninformative and somewhat useless response like yes and no. So let's break it down, okay? First off, and I emphasize this in a lot of what we teach here, microcurrent is not capable of killing or destroying pathogens. People get really into this idea that they can electrocute and kill the pathogens. These are body friendly frequencies. If your body can handle the frequencies and is being infected by these pathogens, the pathogens are doing that because they like the way your body runs. They like the way your body is, right? They're able to settle in and get a foothold. Microcurrent being so natural, being so in tune with your body is not going to help kill or destroy the pathogens through simply passing electricity through it. And this is where the yes and no comes in, right? Because we can remove inflammation and we can remove pain, but we can't just remove the candida. So the goal of microcurrent is systemic health. It's not going to destroy it, but it can help the body alter the terrain and make it inhospitable to candida because the body is capable of this by itself. We're just going to give it a little bump along the way, which is a lot of what we're doing with microcurrent in general. So, protocols that can help with candida, candidiasis vary, but I like to recommend the following, and not all of these to be done at once. So, step one is grounding. So, grounding involves the use of the mitochondrial recharge bundle or conductive pads on the hands and the feet in combination with the program 7 to 12 hertz. And this is done for 30 minutes a day. This protocol helps to ground and normalize the cells in the body. But one effect it has is to balance pH within the body. This is your potential for hydrogen. Studies have shown that candida cannot live in certain conditions. And one study showed in particular that vaginal candidiasis will die off when the pH gets above about 4.5. So simply by doing this protocol, we can help the body kill off Candida because it will normalize and balance your pH. This protocol also raises the question, and it's worked in the past, when it comes to vaginal candidiasis, of vaginal pH. And those that are dealing with vaginal candidiasis, um, and does this support the use of the vaginal electrode? Essentially, is the question here, as an option to enhance treatment in raising, in particular, the pH of the vagina and dealing with candidiasis there. And this is totally a viable and valid option. I've seen it work with people. I think it's definitely there. Obviously, you want to make sure you should be anyway cleaning the electrode after use, because you don't want to cross infect or reinfect. Now, this is when using this protocol, it's best done with the same 7 to 12 hertz program. This is your normalizing, your balancing. It is the best one for working with the body. So a simple 10 to 15-minute treatment there, here and there, may be able to raise the pH of the vagina to the point where vaginal candidiasis just dies off. Okay, so point 2, immune boosting. So this protocol can be done in tandem really with any of the other protocols on this list. This doesn't have to be done as a standalone. It's a good booster. So one reason that the Candida can take over the body, and I mentioned this at the beginning of the video, is simply a poor immune system. And the use of this protocol can boost white blood cell function, actually creates new white blood cells, and can cause the cells in the body to help fight off the infection. So 100%, whatever one of these steps you are taking, you should be adding in immune booster if you're dealing with Candida. So this, though, is a big protocol. And I know I normally show the protocols on these training videos, but with everything that needs to be covered here, there's no way I can do the immune booster even in 10 minutes by itself. It's just not going to happen. So remembering that it is involving the stimulation of the long bones as well as the other organs that are critical in immune function, keep in mind this protocol is outlined in Current Medicine, both the new version, which is really close to being released, and the second edition, as well as in our training platform in video form in there. But it's just simply too much to cover today in depth. So I'm going to refer you to there. You may be able to even find traces of it in longer training videos on our YouTube channel, where you can pick up this protocol. I know we talked about it during the COVID and post-COVID video. Now, mitochondrial recharge is number 3. And really, I wouldn't do this and grounding when trying to treat this. If grounding is not helping after a couple of weeks, replace that protocol with this one. This is doing the same thing we described in the grounding protocol, but it's utilizing blue stimulation instead of 7 to 12 hertz. And this protocol, it's really boosting cellular energy, and it can make it very challenging for anything to affect the cell. So for the Candida to continue to exist when the cells are so resistant and so optimized that their voltage is just making them reproduce, it's very hard for these things to get a foothold and to keep a foothold. So it's a good option as an adjunct treatment in there as well. For oral candidiasis, so this is kind of, this is a bit more untested. I haven't had a huge amount of people with oral candida infections. Maybe 3 that I can think of off the top of my head that have asked me about this over the years. The rest of it's much more common. So if these protocols have not been helping, you should make use of the tongue stimulator, this guy right here, because at least you can treat your mouth and you can hopefully raise the pH in the saliva, the same way that we do with the vaginal electrode for the vaginal candida infections. So you want to essentially use the tongue stimulator. I would just use it on the tongue and close your mouth, because then with that closed, you should feel the current kind of running through your mouth in general. Now, I recommend, again, 7 to 12 hertz. This is the best at harmonizing the body. So this is going to raise the pH of the saliva and beat back the candida, or at least assist your body in doing so. This is definitely the case. Like, again, remembering that immune booster protocol is really going to help your body fight these things off. One key point here, same with the vaginal electrode, make sure you sterilize the tool properly to prevent cross-contamination. Some people, I know they just sterilize these pretty quickly, give them a wipe down. I would, in this case, probably pull the tips off, drop them in something like rubbing alcohol, and put this in rubbing alcohol or in a little cup of hydrogen peroxide, whatever it may be that you use to clean your electrodes. This will help sterilize it. Just leave it in there for a few minutes. You really don't want to reintroduce it every time you're fighting it off, if that makes sense. Okay, so that about wraps it up. Thank you for joining me today. For those of you in the Hache Protocol Private Members Group, I have a crash course I'm running tonight. Hopefully, I will see you there over in the private Facebook group for the Hache Protocol group. This is going to be an in-depth class, about an hour, 45 minutes to an hour long, on foot and ankle pain / injuries. It's a big topic, lots to unpack. It was one we covered a few years ago, but we need to do an update because we've got quite a few new devices now, so it's a little bit out of date. As far as this goes, if you have any questions, drop them in the comments section below here. Otherwise, I hope to see the rest of you next week for another Monday 10-minute training. Take care, everyone. Bye.